Okay. Good morning. My name is Cynthia Vinama Vargas, and today I am representing Dr. Akram Khan's RLC at OHSU called the PRISM Research Team, and we'll be presenting to you today mRNA SARS-CoV-2 vaccine effectiveness against hospitalization, death, and invasive mechanical ventilation, also known as IMV. So with the inception of the COVID-19 2020 pandemic, vaccines have become an indispensable tool to control and slow the spread of the virus and protect the public. So waning vaccine effectiveness has thus come to question as new variants overwhelm new cases, and it's not guaranteed that the vaccine will work the same for all variants because the nature of the virus is not remaining consistent. So for that reason, the PRISM research team at OHSU, along with 20 other institutions across the United States, have worked under the CDC and have been funded by the CDC to discern vaccine effectiveness in the influenza and other viruses in the acutely ill, also known as IV research network. So the variant periods that we are looking at today specifically include pre-Delta, Delta, and Omicron. And to your left is the map of all IV research network participants across the United States. So the objectives that we looked at in our study include, first and foremost, to examine vaccine efficacy in preventing COVID-19 related hospitalizations, IMV, and death in adults. We also researched vaccine effectiveness across different variant periods in preventing hospitalization, death related to COVID-19 infection, and last but not least, to assess efficacy of COVID-19 across vaccination dates and number of vaccines administered in adults. So the protocol timeline is exclusive to OHSU, but it may be different for all different institutions across the United States. But here's what we do. We first and foremost screen patients using EPIC, and we look for possible patients that could be included in our study. Next, we also interview patients. We ask them demographic questions and collect an artificial nasal swab, which is only 3 to 4 inches within the nose, and it's nothing like the COVID-19 test that they do. And we also ship the nasal swabs to Vanderbilt University that do all our medical laboratory processing for us and do any data entry on REDCap for important information about the patient and comorbidities, for example. 2 study groups that we're looking at exclusively are called cohort 1 and cohort 2. The main difference between them is that one of them is COVID-19 positive, which is cohort 1, and one is COVID-19 negative, which is cohort 2. So they both have to be 18 years of age and older, have more than one symptom of respiratory distress, which are just a fancy way to say COVID-19 symptoms, and have to be admitted into the hospital or the emergency department and have a nasal swab collected for all of them. So this is our data that we collected for a study. So first and foremost, 21% of patients experienced IMV or death for all variant periods, regardless of vaccination status. 7.5% of patients that were COVID-19 negative positive experienced death or IMV in the hospital if they took their second dose of the vaccine 14 to 150 days after the first dose, and 14% of patients experienced IMV or death if they took the second dose after 150 days or more after the first one. And vaccine effectiveness across variants goes as follows. So the vaccine was proved to be 95% effective in the pre-Delta period, and 89% effective for the Delta period, and only 86% effective for Omicron period. This is more specific data that we attained in our study, but vaccine effectiveness was seen to increase to up to 94% if you receive 3 doses of the vaccine, and only 88% if you receive 2 doses, regardless of variant period and the type of vaccine that you received. And overall 90% effective of all variants and regardless of the amount of doses that you received. In the case of comparing Delta and Omicron, vaccine effectiveness between them increased if you had 3 doses. So for example, if you only had 2 doses of the vaccine, it was 88% effective for Delta compared to 79%. But if you received the booster, for any vaccine, it was 95% effective compared to 94% and Delta and Omicron. So the gap was closed. The conclusion that we received in our study was that first and foremost, increased vaccine administration offered greater protection for IMV and death because it was adequate and strong enough protection for both adults and immunocompromised individuals. And lastly, it was found that with coming variants that there was a difference between vaccine effectiveness, but it was closed when you increased the number of doses that you received. And here I inputted a snippet of a study that was published by the CDC that includes our data that we received at OHSU. So the reason why it matters is that it just reaffirms the idea or what we already knew about the vaccine, that it was effective against COVID, but it was also effective across different variants. And it promised a method for circumvention for severe outcomes such as, again, IMV and death, and informs the future vaccination recommendations that you can make by the CDC. For example, the new bivalent COVID-19 vaccines are coming out, and that's because of the study that we did here today. And so here, I would like to say a special thank you to everyone in my RLC, especially Jose Pena and Jesus Martinez, who helped me understand the data that we collected and the protocols that we were following in the lab, and to all my fellow Bill Exeter scholars who are here with me today. So Habiba, Juliana, Suha, and Aaron. And here's my work cited, and any questions? Yeah.
I was curious why you guys decided to combine IMV and that was the same outcomes.
Well, we termed both of them as being severe outcomes because IMV can be very disastrous for your lungs, and that's not something that you want. So for that reason, I think the CDC combined them together, but that was a really good question. Yeah.
Was there any difference in the data that like helped?
Yeah, so there was a difference, like an inverse relationship between number of comorbidities, or if you were more immunocompromised, and vaccine effectiveness. So if you had more immunocompromised conditions like COPD, HIV, diabetes, the vaccine was less effective, but it increased with more doses that you had. So for example, if you had just the regular series, which is dose 1 and dose 2, it increased as you added more boosters. Any other questions? Yeah.
You mentioned that it's better to get 3 doses versus 2. Was there a difference in the type of vaccine that you get, like Moderna versus Pfizer?
There was not really much of a difference, or not something that we were especially focusing on, or at least what the CDC was focusing on specifically, from what I know. Yeah.
And the last one. So then you shared that the data went into that one paper with the CDC. We got like a call with CDC folks. I didn't put like a Zoom call. You're like, that's pretty dope, you know?
Well, at least not for like the Build Exeter scholars, but we know that our PI, Dr. Akram Khan, he did, and some of the research assistants too. But we were told of them, but we never actually like attended, and they were all online. So sometimes we weren't even in the office.
Well, that's super cool anyways. But thank you.
Thank you.
Seconds. But next up we've got Madeline Amesqua, who's a student, a Bill C6 student of Dr. Maria Blue. And they will be presenting language proficiency effects on use of complex sentences in bilingual children. So take it away.
Thank you. Well, I was gonna introduce my topic, but you guys already know my presentation's on. Oh, let's see. Oh, it's right clicker here. Oh, it's not working. Okay, cool. Okay, so before I get into our study, I would like to define some terms for you guys to make sure we're all on the same page. And language proficiency is not necessarily one thing, but rather a collection of various skills that include vocabulary, grammar, sentence length, and overall fluency of a speaker. A complex sentence is a sentence with more than one clause, and a clause is a subject and a verb. These clauses are usually connected with conjunctions. And for this particular study, we were focusing on conjunctions that reflected causal and temporal relationships. So causal and temporal relationships are actually the first connections that children around the age 5 begin to use when they're linking their ideas. A causal relationship indicates cause or reason, words like because and why, whereas a temporal connection reflects time, words like until, meanwhile, and as. The purpose of this study was to determine how Spanish and English proficiency affects the use of these temporal and causal relationships. This was done by collecting narrative samples in 5 to 7-year-old children, bilingual children. And so why is this important? Why does it matter? So The use of these causal and temporal connections can actually determine how a child is interpreting their environment, which then would affect their school performance and social relationships. Some things my lab did to be able to make this study possible was, again, collect those language samples from a story retelling task, test the children to make sure they were typically developing with these various tests, and also code their language samples in the SALT program, which is just a coding program. My contribution to the lab was preparing to be able to code. So I did a lot of reading, a lot of literature reviews, summaries, and then eventually a big chunk of my participation was coding. Again, we use SALT to code, and like I would compare our coding samples with my lab partner for making sure we were like doing the same thing, that we were being reliable because we're new to this. And this is what I would look at all day. This is what a language sample on SALT looks like. This one's in Spanish. And so this is basically what a child would say, somebody transcribed it. And usually what I would do, let's see this work. What I would be working on is putting this stuff in, that stuff in the end. That's just coding for sentence complexity. And the number is giving them a score of how many clauses are included in their sentence. This is an English one. So this is a sentence, for example, right down here that has 2 clauses that the child used. So if it had SI1, like these guys, I still had to go through and do it, but it wasn't a complex sentence. So, and this is our graph for the results for our Spanish language samples. As you can see, as language proficiency down here on the x-axis increased, the more likely they were to use more clauses in their sentences. Therefore, language proficiency did affect the use of complex sentences. However, even though I feel like the 2 graphs like look a little similar, they're still very different. And in the English language samples, even though they're still kind of following that same pattern, language proficiency and sentence complexity did not have a strong enough relationship to indicate one was affecting the other. So again, what does this mean? This means that in the non-mainstream language, which in this particular study was Spanish, language proficiency does affect the use of complex sentences. However, in the mainstream language, which in this case is English, they did not have a strong enough relationship to indicate that one was affecting the other. Therefore, the use of complex sentences may be affected by other factors other than language proficiency. And then I'd like to take some time to thank my principal investigator, Dr. Kapanzoglu, my lab partner, Cielo, that's sitting in the back as well, and NIH, Portland State University, and Build Exito for making this possible. Any questions? Yes.
Would you be like to put up the language proficiency slide from the beginning again?
Yeah. There you go. Mhm. Any other questions? Oh, yes.
So why do you think results were different for the mainstream?
Yes, I was hoping someone would ask. Because my PI told me I can't put it up there, but I'm like, but she said I could say it verbally. Because this is actually like a separate direction we could take next. This particular study is only focusing on whether or not they're influencing each other, if there's a connection. However, a further direction could be like, what is causing this connection or disconnection? And one thing that she was kind of telling me was, for example, children in their classrooms can see that English is a valued language, and regardless of their language proficiency, they're going to want to fit in with their peers. So whether they're good at it or not, they're going to want to try and use those complex sentences. Whereas in Spanish, maybe not a lot of their peers are speaking that language. Therefore, if they can't, don't have the skills to use those complex sentences, there's no need to try and push themselves because they're not going to get any satisfaction from it. Because, if they want to be accepted, not a lot of people are speaking Spanish. It's not going to be a huge motivation for them. Yeah. Mm-hmm. Yes.
So this is, you said mainstream, so this is in the lens of
Yeah. So.
information.
Yeah, so in the US, the mainstream language is English, it's the primary language, whereas any other language would then be considered non-mainstream. So then therefore, if you were to do this study in a different country where their mainstream language is different, we would assume that they would get the same or similar results. Yes.
Do you think you would get similar results with other non-mainstream languages within English dominant environment? I mean, this is.
Yeah, right. No, yeah, for sure. It's a good question. I personally think we would, just because again, if like the result or the interpretation of the results is correct, ideally, if they're speaking a non-mainstream language, that means that their peers are most likely not gonna be, it's not gonna be common. Therefore, they're probably not gonna wanna force themselves if there's no need. But then again, their exposure to the language can also influence what like they're pushing themselves to do. For example, we don't know how much exposure they get at home. Maybe they want to be like mom and dad and they're not as great as in the language, but they still want to try and mimic those complex sentences that they use. So again, like this would be a great study to do next, because there's so, I mean, I don't know how we'd be able to condense it because there's so many factors that can influence how well we are in a language, but it would for sure be an interesting direction to take. Any other questions?
Because I think in some contexts, Spanish could be like a secondary mainstream language. Yeah.
Yeah, no, for sure.
Last one.
Yeah.
How's the, or when was the data collected? Because I know we just had COVID.
Oh my gosh, right. And that, you know what? I am not sure, but I just know I was sitting in the lab looking at this. There was information, I'm pretty sure the date and stuff is on top, but I wouldn't really look at that because that's not what I worked with. Dr. K was just like, code this for me. This is how you do it. I was like, okay. But I probably should have looked, but again, I didn't really look at their information at the top since some of it is confidential. Yeah. Mhm. But is that it? Okay, thank you.
Our next presenters, Juan Din, and their PI is Dr. Dara Schreifer. They're a Build C6 scholar, and they'll be presenting the research moderating influence of ninth grade teachers' approach to ability grouping on immigrant students' sense of school belonging. So with that, take it away.
Hello, everyone. Again, my name is Swanding, and I and my PI, Dr. Dara Schiffer, has been working on a project called the Moderating Influence of Ninth Grade Teachers' Approach to Ability Grouping on Immigrant Students' Sense of School Belonging. So some background information on this share of US students who are immigrants is increasing. Studies on immigrant students often focus on academic outcomes, but we know that social emotional outcomes also intertwine with students' achievement and the likelihood that they complete high school. Student sense of school belonging and acceptance is an important determinant of persistence in school, but it remains unknown to what degree immigrant students in particular feel accepted at school. And we would expect that students whose native language is not English would feel less school belonging. Also, the ways that teachers arrange their classroom may play a key role in immigrant students' school belonging, sense of school belonging. So because of this, we came up with a project that focused on two research questions. The first one is, how does immigrant ninth graders' native language relate to the degree to which they feel school belonging? And the second question is this relationship differentiated by the teacher's approach to grouping students? And this is a visual representation of our research questions. The independent variable is the student's native language, and the dependent variable is the sense of school belonging. And then we add the moderator, which is how teacher assigns small group in the classroom and how this affects the relationship. And we also add these control variables in our analysis. So the data that we used was the high school longitudinal study of 2009 data. And our sample was the 3,655 immigrant students. These are the variables that we saw earlier in the visual representation. We can see that you can see on the left side, The four ways that teachers approach to grouping students. The first one is that they group students in similar ability in one group. And the second approach is grouping students with different ability levels in one group. The third one is grouping students without regards to ability level. This could mean grouping students alphabetically or randomly. And the final one is letting the students choose their own group in class. So the methods that we used was using the regression models to predict immigrant student sense of school belonging, depend on their native language. And then using that relationship, we each time we would add each teacher's approach to grouping the students and the moderator, and to see how this affect the relationship. So this is the results that we have. This can be interpreted in a few different ways, but the interesting one that I found is that when students are grouped with similar ability level, students who speak English and another language as their native language, have higher sense of school belonging compared to those who speak Spanish and an Asian language as their native language. And also when students are grouping different ability levels, this is a lower sense of school belonging in native Spanish speaker compared to other student groups. And this is the results that we have after adding a control variable. As you can see in the right side, when students are allowed to choose their own group, there's a significantly lower sense of school belonging among native Spanish speakers compared to the rest of the group, the rest of the students. So that brought us a question, what is it about being math classes where teachers have students join their own groups that negatively relates to native Spanish speakers' sense of school belonging? This is a question that can be brought for future study. And this research is supported by the National Science Foundation and the NIH VSABLE program at PSU. I would like to thank everyone in my RFC for helping me with this project, and VSABLE staff and advisors for making everything happen. Thank you. Yes.
I guess I got a lot of questions. Really nice job. I am curious how sense of belonging, school of belonging is measured, and were students given the test? I'm sorry, you said this might just have been in their native language, the survey that they took or whatever they answered to rate their school belonging.
Sorry, can you repeat your question
Yeah.
again?
So how did what do you know any of the types of questions students answered about the level of school belongingness that they felt? And do you know if the surveys were given in their native language or in English?
On this information, I'm not sure. I don't have the answer for that because this is the analysis that I use with like already
It was already
data,
collected.
yeah, collective. So
Got it.
yeah, I don't have a question for that. Answer. Thank you.
So the numbers changed a lot, the analysis of the first graph and the analysis of the second graph changed a lot when the control variables were in. What do you think that means?
That's a very good question, but I don't have an answer for that. Yeah.
What, do you know where this research is, what region of the United States that they have the data taken?
It's I think it's a data over the US.
Okay. so
Yeah.
all of it. Questions? I'm sorry.
Yes.
And what was the age of these students?
These are ninth graders.
Ninth graders.
Yeah.
So what they only met?
that's the data that we have, and that's the data that I was using. So
It's like a giant data set, and they're focused on STEM. So they only survey the kids about math.
yeah, we also do the same analysis on science teacher as well, which is which is presenting on the math teachers.
Do you think there's enough information in the data that we're working with to make recommendations to teachers about students? Do you feel confident with recommendations on how to reach students?
I think there needs to be future more studies to create the recommendations. Yeah, so I think my project is the earlier stage on the stage. So there definitely there should be more research on this. Was there enough information to have recommendations for teachers?
Thank you.
All right, so we got our next presenter, One. We're gonna present the research ventilation imbalances in mild to moderate chronic vapor. And the PI is Dr. Akram Khan. They're a cohort 6 scholar. So with that, I will let Soha take it away.
Hi everyone, my name is Soha, and today I'm going to be presenting ventilation imbalances in mild to moderate chronic obstructive pulmonary disease. And I did this with the pulmonary critical care and sleep medicine research team at OHSU under Dr. Akram Khan. So COPD is the third leading cause of death in the world alongside diabetes and heart disease, and its diagnosis relies on a spirometry test, which essentially measures the force of exhalation in one breath. However, these tests do not fully encompass the complexity of COPD, so patients with the mild to moderate version of COPD are often undiagnosed despite having high mortality risk and physiological impairments. On the other hand, fluoroscopy makes a real-time video of movements inside a specific part of the body by passing x-rays through that part. So it's essentially like a rotating x-ray that takes pictures. And there's also something called a lung ventilation analysis software, and this provides a highly detailed map of both the patterns of lung motion as well as any sort of detriments that we can see in the lung function as the person is breathing. So the specific aims of this study is to determine the validity of the LVAS or lung ventilation analysis software in quantifying ventilation in COPD patients. Also to determine if LVAS provides enhanced clinical assessment of lung function compared to the standard assessment, and also to determine a sample size that will show a significant clinical outcomes of COPD using the 4D imaging. So the overarching goal of the study is to use fluoroscopy as the main method of diagnosing and monitoring those with mild to moderate COPD and eventually leading to better treatments of the disease. So there were 4 main categories of the participants in this study. To start, age was 1, and they had to be between the ages of 30 and 85. Not specific to gender, but the female had to be of non-bearing potential or on contraceptives. They also needed to have a COPD diagnosis with an FEV1 FVC ratio between under 0.7, which is like the standard for people without COPD and normal lung function. And that ratio essentially reflects the amount of air you can forcefully exhale from your lungs. They also have to be current or former smokers, and also should not have any clinical abnormalities on the CT scans. So our data is determined by demographic data, study questionnaires, a 6-minute walk test, and a CT that are obtained and assessed during scheduled visits. Patients maintain their usual pharmacological therapies and exercise regimen that's prescribed by their primary care doctor. And these data points are repeated between 4 to 8 weeks and 10 to 12 weeks for a short-term and long-term assessment. So this is typically what the visit would look like. In one day, we would start with questionnaires. We would do a pre-spirometry test, conduct a 6-minute walk test, collect a blood sample, and then the main event was the lung imaging. And then we would do a post-spirometry after that to conclude the visit. So while we do not have the results of the study yet, since it is ongoing, we do have a planned analysis of how we want to look at the data. To start, we have imaging data that we want to look at. And so we'll be looking at the LVAS's ability to define ventilation defect percentage and ventilation heterogeneity, essentially the uniform distribution of air in the lungs. To determine COPD severity, we'll also be looking at lung function and the ability of LVAS to provide enhanced clinical assessment of lung function compared to the standard 6-minute walk test, spirometry, and CT. And we'll also be looking at clinical assessment and to determine if the ventilation defect percentage and heterogeneity are comparable to the standard questionnaires that people with COPD are usually asked for their like health usually that day. So understanding the imaging data, clinical assessment, and lung function provided by this study may be a crucial first step to decreasing the detriments of COPD and developing a more effective way to diagnose those with a mild to moderate version of COPD. So I wanted to give special thanks to research coordinator Cassandra Ahmed. She guided me the most during this process, and also my fellow Build Exeter scholars for their unwavering support, and also Build Exeter. And these are my references, and thank you. Any questions?
It's kind of like a two-part question. For this study, did they have to be tobacco smokers?
Yes.
And since this is the state of Oregon, marijuana is legal, did you not include any marijuana smokers?
No, like if they said that they were, it didn't really have effect in their ability to be included, but we were looking at nicotine.
Okay,
Yeah.
thank you.
Then
Yes.
kind of follow up to that, if the data or if the study's ongoing, does that mean like it started during COVID?
Yes.
Or, you know, participants, maybe they had COVID or kind of how did that play?
Well, we typically excluded those who did have COVID or who've had COVID in the past, just because we wanted to just look at their COPD diagnosis and not have and try to limit all the other factors that could play into it. Yeah. Yes.
Yeah, you mentioned an exclusion where the women can't give a show. Why is that?
That's because of the they're exposed to radiation through the CT and fluoroscopy. So we really wanted to limit that since that can be damaging to a fetus. Yes.
So the inclusions look very specific. Was it hard for you guys to find people to study?
Yeah, so this was actually hard to find because we also limited it to how many people were outpatient at OHSU, because this study is specific to OHSU. So we only have about like 15, which is also the expected. So we don't have like an excessive amount of people. Yeah, that's also why we're looking at sample size to determine if the sample size would even allow us to gain like a full perspective of the study. Yeah. Yes. Probably next year. Because right now we sent the software, the analysis that is being done is done somewhere else. So they have to get the images back to us, and then we can look at the regression fault lines and all that. So there's a lot of stats involved. Yeah.
One last one. So you mentioned this 6-minute walking thing, like what?
Yeah, so this so the 6-minute walk test is basically like it's a long hallway, probably longer than this one, and we lay out a meter tape thing that's like really long. And basically we're trying to measure how long they can go without stopping. And so they're just walking straight back, and we can't tell them keep going. They just have to do it themselves. And yeah, we just like would mark how many laps they could complete within the 6 minutes. And that would tell us like about their lung function and health.
What?
Yes.
Why is it?
Because they have like respiratory impairments, we also don't want to exhaust them. Yeah, we don't want them to pass out or anything.
Sweet. Well, thank
Yay,
you.
thank you.
But I would like to introduce Marilyn Rios Bale, who is a student researcher for Dr. Bruce Goldberg at OHSU. Marilyn is Field C6 scholar, and I will let them introduce her topic.
Good morning, everyone. My name is Marilyn Rios Bale, and today we'll be talking about social needs amongst those experiencing safety concerns. I was placed in the Accountable Health Communities, a lab under Dr. Bruce Goldberg, a project a part of the Oregon Rural Practice-Based Research Network at the Oregon Health and Science University over a year ago now. The AHC project is a model made by the Center of Medicare and Medicaid Services that works to connect Medicare and Medicaid beneficiaries to needed community services using a standardized questionnaire that identifies unmet needs. We screen for food, transportation, housing, utilities, and safety needs, and provide a community resource list in their zip code area, working to reduce social determinants of health. Now, before I was placed in this lab, this was done while participants visited clinical sites, and due to COVID-19, that switched over to phone calls, text messages, screenings over the mail, and that was the majority of my work. Social determinants of health are non-medical factors that influence an individual's health, such as access to education, income, violence, etc. While connecting with individuals and conducting screenings over the phone, I became very interested in our personal safety portion of this standard questionnaire and the role that might play in their overall number of unmet needs. In doing research, many of the articles I came across focused on attitudes, beliefs, and ability of healthcare professionals to adequately help those who may be experiencing safety crises or concerns, and rather than the resources and services of healthcare settings had to offer to those individuals. The goal was to take a deeper look at the overall needs of individuals who screened positive for safety concerns and whether they had a higher number of unmet needs than those who did not screen positive for safety needs. The individuals who were screened were done so at clinic sites pre-pandemic, and a total of 3,984 individuals were screened, 301 of those who screened positive for safety concerns. Individuals were using a 20-question standard questionnaire, four questions of which focused on personal safety. Individuals were asked if they were comfortable or felt safe to answer these questions. If not, these questions were skipped and we proceeded with the rest of the questionnaire. A score system was used to identify safety concerns. A score of 11 or greater were flagged as safety concerns. It is also important to note that even if individuals were not flagged for safety concerns by the screener, it does not indicate that they were or may not be experiencing safety concerns. Additionally, an AHC protocol was set in place if individuals answered fairly often or frequently to questions 10 and 12 or were actively experiencing a safety concern. Those conducting the screeners are able to connect them to shelters or refer them to additional services. So this first graph here shows the average number of unmet health-related social needs and members who screen negative for safety needs among races. And most groups show to have a 1 to 2 number of unmet needs. The second graph here shows the average number of unmet needs in the 301 individuals who did screen positive for safety concerns, which shows that every racial and ethnic group across the board had an average of 2 to 4 unmet social needs. And then here's a graph of comparison of both groups. It is also important to note that the group of individuals who did screen positive for safety concerns was a smaller sample than those who did not have safety concerns. In conclusion, participants who screened for safety concerns across all racial and ethnic groups had a higher number of unmet needs than those who screened negative for safety concerns. These results may be significant for healthcare settings' importance for screening for IPV, interpersonal violence, healthcare professionals working with survivors or victims of the IPV or domestic violence programs or shelters, IPV programs and shelters, and overall social services. Additionally, future directions include better understanding the needs of individuals with safety concerns such as identifying the most prevalent needs among this population and understanding the depths of surrounding the circumstances of those experiencing safety concerns. And this can look like taking a deeper look into the 4 safety questions and seeing how individuals answered and the severity of the answers of these questions. I'd like to thank Dr. Bruce Goldberg, which I work closely with this project, both Exito for giving us the time to work on our research and giving us advice, and then as well as the National Institute of Health. And like all the references. Any questions?
What areas do these surveys in?
So we focus in rural areas, but all across Oregon as well.
Okay, cool.
Yes.
And then what would you do moving forward to diversify the fight type? We've seen, I mean, especially for something like this, it is important to get a large population. So moving forward, how would you possibly do that?
So we do screen a larger number of people, and I did only have a smaller size to work with. That's due to just software and stuff. So there is a larger group that we could sample from that we could use for further studies. Yes.
I may miss this, but can you give an example of a couple of health-related social needs that are associated with safety?
Environment, one's a personal safety and environment. So living, access to transportation to get to services is a big one as well, especially working with a rural area. That what's one of the biggest barriers we saw was transportation and things like that. Yeah.
And does the research look at associations between specific needs and sort of specific social needs and specific safety needs?
No, but that is one of the things we would in the future directions of focusing on which needs are higher and which ones we could work to connect more with individuals who are experiencing safety concerns.
I'm not sure if you can answer this, but is there a way to determine if someone then is like having safety concerns but can't, like, is fearful to answer the questions?
Well, yeah, so we do ask before, like, moving on to these personal safety questions, if they're safe, if they feel comfortable, and if that in that moment that they disclose that they are experiencing an active safety concern or crisis, then that's when we can perform a warm handoff and call 211 or connect them to shelters in that place to get them to safety.
Yeah. When was the data collected?
So the sample that I was working with was 2019, so pre-pandemic, but we have been and we're screening throughout the years and are still screening now.
I don't know if it's also, but I know that when we did a surveys, in the future, we can interview some people in, interview, but like the lab, so take people from the surveys that we have characteristics of interest and then interview them.
That is a good question. I'm not sure as of right now, but that is something that could possibly we can look into. Yeah. Okay, great. Thank you.
So yeah, that kind of wraps up. Wait, there might be something in the chat. Ooh, someone said, what thoughts do you have about the amount of variation in unmet needs? Is this the right? Yeah. Unmet needs across racial groups who have safety concerns. What might explain this variation?
So, well, we do look at the 5 main social needs of food, transportation, housing, utilities, and safety. And while in this particular study or research, I didn't look at what specific needs they have, and that is part of the future directions. Variation can include a lot of things, as like income is a great factor of the ability to access things, transportation, and stuff like that.
Yeah.
Thank you.
Yeah, sweet. Okay.